So today I am presenting Dr. Loeza. Dr. Loeza is a family physician working at a Venice family clinic. Since 2001, she has provided primary health care to the underserved patients in Venice and teenagers at a high school-based clinic in Santa Monica. Dr. Loeza has worked on implementing and maintaining an electronic health record at multiple clinic sites. She is a faculty advisor at UCLA, and she is a faculty advisor for the Latino Medical Student Association for UCLA. Dr. Loeza is a Chief Information Officer and is on the board of Alliance in Mentorship, in which she supports Mi Mentor. So if we can give a warm of applause for Dr. Loeza.
Hi, everyone. Thanks for staying. And imagine the raffle is really good. There must be a good price. So I work with Dr. Partovi at Venice Family Clinic, and that's where she started getting interested in the homeless population. And I've also been working. And I think, as if you're going to become a doctor, a nurse, a pharmacist, anything, you will eventually meet a homeless patient. And I just think that always so impressed by doctors that take care of homeless patients. It is one of the most difficult jobs, and she has a very huge heart, and to give so much to this population, I'm always very impressed with doctors that do that. So I didn't know what to call my talk. I hope it comes up. So I just wanted to tell you guys, give you some inspiration, or tell you what it was like for me to become a doctor. And a lot of people tell me that when they meet me, they've never met a Latina doctor, or they've never seen a Latina doctor. And I think Dr. Ramirez is here. She's a doctor. She's a Latina doctor, and so am I. And I wanted to give you guys some encouragement, or feel like you could do it too, because I think sometimes when you're in your journey through medical school and being a pre-med, people, or if you declare you're a pre-med, oh, you're intense, people start saying different things to you, or you feel like you have to be perfect and have a 4.0, or if your parents never went to med school and no one in your family went to college, you're like, well, I'll never make it, to get discouraged. But there are people people like us who do make it, and I just wanted to share my background with you, and my email's there if you guys have any questions. I just wanted to share my story, or how I became a doctor, and it's just more about me and what I did to get to where I am today. So this is my grandpa and his father, and I like this picture because it's the only picture I have of my great grandfather, and I just think that's really cool. And my family's from Mexico, and they're from this small town called Michoacan. These are the Loezas, the guys. And my mom is from another part of Mexico, but my mom came here when she was like 17 or 18, and she literally used her sister's green card and walked across the border. And she says she had about $12 or $16. I don't remember, but it wasn't a big amount. And her brothers and sisters were waiting for her. And then my parents met at a nightclub in Los Angeles. And that's cool. Before Tinder and OkCupid. I actually shouldn't talk about it that way. That's me. That's me. My dad, he came here when he was like 17 or 16, and he was a bracero, so he came to work. He was just going to work and then go back. And, life happens. You come and you work, and then you want to stay, right? You meet people, and you make friends, and you make money, and so you want to stay. So he started working in the fields in Watsonville, and he picked corn. And he told me that was the hardest, most dangerous, hottest, painful job he ever did. And he worked in a factory. He worked as a gardener. My dad, all I ever remember of my dad growing up is him working so much and so hard. And his last job was gardening, and that's me. And when I was born, I was breech, meaning that I came out feet first. And so my big head got stuck in my mom, and they were yanking me out, and then my left hip was just kind of like flopping. So I required a lot of surgeries. I required pins. I required having my hip broken, harnesses, braces. No one really remembers how old I was when I walked. It was probably pretty late. And that's like I have a full cast that goes from my waist down, and that's my little brother. He has an abnormally large head. And it's like, his head's normal, but I like to make fun of him. I still have those pins in my hip, and I'm going to need another surgery to have my hip replaced soon. I keep delaying it, but it's going to happen soon. But this is what made me, this is pretty, like you think, wow, that's really bad. That's a lot of adversity, but this is what made me want to become a doctor. So I met a lot of doctors, and I was always at the doctor's office. I was always around doctors, and I thought, and I still think that doctors are heroes, that they're superheroes, that they're awesome, and I just, I was like, I'm going to be a doctor, and I'm going to be an orthopedic surgeon. I'm not. And, this is what I was going to do. I was going to fix people, and I was going to make them walk, and my doctor, he was like, I still remember him, super tall, white guy, like all these people following him. I felt like his white coat was flowing in the air, and everyone I was in orthopedic hospital, he made it so that they could walk. So to me, I was like, there's nothing, but this is the best job. Like, I was like, I'm going to be that guy. So this is me with my brace. I always wore like a dress and some pants because my mom wanted to cover up my braces. And this is me, and I was the typical kid. There I am, my birthday party, and the guy in the blue up over my left shoulder, he's an emergency medicine doctor. And so he's my first cousin, and here's another thing that really helped me. My cousin, he was valedictorian of his high school. He went to Yale, and then he went to UCSF for medical school. He played football, crew, and he was an athlete, and he was like super intelligent. But to me, he was just my cousin, and I was like, well, if Mario can go to medical school and get into college, then so can I. And I saw Mario do a bunch of dumb stuff. I saw him walk around with a piece of cardboard and break dance on it. So I was like, he's not all that great. Like, I'm like, little did I know how awesome my cousin was. And like, he's famous, and I was like, but luckily I had this guy here too, who was, my cousin. He got into med school, so I was like, you know what, I could do it too. So there's a lot of like believing in myself, which is good. And I'm the oldest of 5 kids, and those are my brothers and sisters. My mom had 5 kids in 6 years. The little one is really a little badass because we were so mean to her. But I had, I'm the oldest of 5. We lived in a 1-bedroom house in West Los Angeles, like on Olympic and Barrington, until I was 15 years old. So we were close, and I went to Norris Dairy Elementary School. I'm not in that picture. It was the only one I could find. And when I was in elementary school, I flunked first grade because I didn't speak English. So I only spoke Spanish, and now my Spanish is terrible. So I only spoke Spanish, and my parents only spoke Spanish. So I would speak Spanish at home. They'd watch TV in Spanish. And then I would go to school, and they just thought I wasn't that bright. They didn't know why I wasn't learning, or, no one took the time to figure out what was wrong with me. But somewhere around the second time I did first grade, I learned to speak English. And once I did learn to speak English, every now and then I caught up. So I caught up to everybody. So I was at Norris Dairy Elementary for 7 years. And this is me, and I'm 15, so I just want to tell you, I had, just regular Mexican-American kid. I had a quinceañera. Back then, you wore white dresses. It's kind of embarrassing. But I always think this picture is funny, because this is the age when they were making me, wanting me to be a little perfect woman, like sew and cook and clean. And I was like, this is the age I was like, no, I'm going to be a doctor. So I was like, this is when I had my 3rd or 4th surgery, and this is when I was sure I was going to be a doctor. And this is when I met Dr. Madge, my ortho doctor, and this is when it was like, even though I was being told different and steered different, in my mind, I was like, I'm going to be a doctor. So this is kind of like at the age when I was like definitely sure. And these were my grades in the 7th grade. Nothing stellar. Nothing really good. D+ in spelling, I think is still probably true. And, no one would look at this report card and say, your daughter's going to be a doctor, right? They're like, and I missed in the 7th grade, because I had my surgery, I missed, a lot of days of school, 28, and I think I probably almost flunked 7th grade too, if you really, I think nowadays they wouldn't let you move on or they make you make it over. So I was not like on the academic decathlon pathway, so I wasn't gonna get into Yale with these grades, right? So in high school, I started doing really well, and I started taking, they put me in regular courses, but I had already decided that I was gonna be a doctor, and I really didn't know what it took to be a doctor. All I knew is that you have to get A's. That was in my mind. A doctor gets straight A's, they're a good student, so I was like, I'm gonna do that. So I was like, always trying to get good grades. I was put in regular classes 9th grade, and I asked my counselor, well, why can't I be in honors? And she was like, well, no, you have to get A's first. So I got A's, and then I was in honors classes. I took AP classes. I went to a Catholic high school. I graduated 7th in my class. I did as many activities as I could. I started volunteering at this age at UCLA. I was a patient escort, so I would move patients from room to room. I would run and get things, and then I did over 100 hours, and once I was done 100 hours, then I was able to move over to the ER, which was my ultimate goal, to get to the ER, right? So, I was like, already here is like an intense little pre-med in high school. I was like on fire, like I'm gonna go to medical school. And when I went to apply to college, I went to my guidance counselor and I told her I wanted to go to college. And mind you, I was 7th in my class, and I was told that I could only go to community college, that I would never get into college, and not to bother to apply, and she wouldn't write me a letter. So I was like, most kids have been like, oh, I didn't tell my mom and dad because I knew my parents wouldn't know what I was talking about or understand. So I went to my junior year counselor, and I told him, hey, this is what this lady said. So he gave me a letter, and I got into college, shockingly enough. And I went to Occidental College, and also there I was like, when I went to college, I did okay. I didn't have great grades, but I did well. I graduated in 4 years, and physics was really hard for me. I didn't do so well in that. I thought maybe, well, physics is pretty hard. I might not get into med school. And after college, I took 2 years to study for the MCAT and apply, and I was a teacher working full-time, and I worked at South Central LA, and then I applied to medical school during this time. And then I went to UC San Diego Med School, and the reason I picked San Diego is so I wouldn't live at home. So I was always trying to run from my parents. So I picked Occidental College because it required the freshmen to live in the dorm the first year, and I knew that that would be the only way to get out of my house. Like, I was like, if I tell my dad I got into UCLA, he's gonna make me live at home. So that's how I picked my college. I'm not recommending that, but this is what I did, So I picked, I could have gone for free to UCLA, but instead I paid thousands more dollars to go to a private college, But I don't regret it. It was really great for me. Then I went to UC San Diego for medical school, and the same thing. I got into USC, I got into Drew. My dad said, well, you can live at home, and I was like, Dad, I'm going to San Diego. And that's how I picked my medical school, because my parents wanted me to live at home. So I was like, no, and this is literally all the Latinos in my class, right? This is literally that's it. There weren't any more. I see Dr. Montes, Dr. Gonzalez. These were the only Latinos in my class. Medical school was really hard for me. It was a shock. I couldn't believe how hard it was. I was not ready. But I did it. There were a lot of times I didn't do well on a test. I just took it again, or, I just tried, and I took step 1. And then for me, after step 1 and the clinical rotations for me were awesome. That's where I really did well. But it wasn't easy. It was a lot of, hard work, not messing around, and, but it was totally worth it, and I really enjoyed it. And also I remember less of med school now that I'm older. I don't remember it as well. And I participated a lot in the Chicano Latino Medical Student Association, and this is in 1997. This was all the Latinos that graduated from all the medical schools in California, so it's not a big number. So, you know, and through my career, through my path, I've noticed it was hard to find Latino medical students. It was hard to find Latino attendings and physicians that you want as mentors. The patients were always so excited that you spoke Spanish. So it was a tough time in that way. And this group is, you know, very small, and it's still a problem today. And I did my residency here in the Inland Empire. I started, it was when I first came here, it used to be called San Bernardino County Hospital, and then we moved to Arrowhead Regional Medical Center. And I lived here in Colton, Fontana, and residency was like the best time of my life. I was super excited. I was finally a doctor, and we were working and having fun, and we got to do some of the most interesting procedures. We lost some patients, but we saved some patients. It was probably some of the greatest times. I loved residency. I had so much fun. And I really love family medicine, so it was the perfect fit for me. And these are my family medicine residents. Some of them work in the Inland Empire still. These are my friends. And I work at Venice Family Clinic, and I grew up uninsured. So the whole time we were kids, we never had health insurance. So I went to Venice Family Clinic. I was a patient there since I was a little kid, and my brothers and sisters were patients there too. I got my physical exam before I went to college at the teen clinic at Venice Family Clinic. And it was my second job out of residency, and I've been working there since 2001. I was shocked because they hired me when I was 7 months pregnant. I was like gigantic, asking for a job, you know, big Mexican pregnant lady asking for a full-time job. And they were like, yeah, we want you. And I was like, I can't believe it, you know. So I've stayed there ever since. The nurses would tie my shoes because I couldn't bend over. So it was like, I was like, I'm home, you know. I'm back at the clinic where I used to be a patient, and some of my patients were my parents' friends. And so I've been at this clinic for, you know, since 2001, and I think that if you ever get a chance to work at a community clinic, you get to work with a really needy population. It has been very fulfilling for me. And also, there's the website in case you guys want to volunteer. If you live in West LA, we're always happy to have people volunteer. We need them. One of the things I wanted to talk to you about is the Latino physician shortage. And so the number of Latino physicians has dropped, and if you look from 1990 to 2020, it's dropped by 22%. And the Latino population continues to grow. Our patients really need Spanish-speaking bicultural doctors that understand them. And it is really a huge crisis. I think a lot of people suffer because they don't have health care. My dad had Parkinson's disease. He just passed away in October. And it was always sad for me that he never had a doctor that spoke Spanish to him when he was going to Kaiser Cadillac, his neurologist, the ER doctors. None of them spoke Spanish, and I was always there to translate whenever I could be, or my mom or my sister. And I always felt really bad for my dad. I would tell them, you know, hey, they would start talking to him in English. I'm like, you know what? My dad doesn't speak English. He only speaks Spanish. And then they would talk louder. And I'm like, he's not deaf. You know, it's truly sad. If you guys have the capacity, even if you aren't Latino, if you guys could learn Spanish, it's very rewarding. There's tons of people here in California that need you. So it will, not having someone who understands your culture and your language will negatively affect your health. So if we don't meet that need, our patients will suffer and our community will suffer. So I've been part of Alliance and Mentorship, and one of the things we want to do, you know, with Dr. Ontiveros, Montes, Gonzalez, and Talamantes, we've been trying to be the mentors for underrepresented minority students that want to go into health careers. So we're the board, and we have our app, and I know they were here at a table. We have the Mi Mentor app, and what we're trying to do is put together resources. If you download the app, you can request me, you can ask me questions, and we're always putting opportunities for you guys to have for health conferences, mentoring events. But it's in response to seeing this physician shortage, and Dr. Montes and I were in medical school together, so it's a really small community, but we want we want to have, increase the number of Latino physicians in California, and we've been working on this for the last 4 or 5 years. So if you can, go to the Mi Mentor site and download the app. Everyone's welcome. You don't have to be Latino, but I think you have to be Latino curious or interested in, or have, I also work with Flying Samaritans, and I think there was once someone told me they were here from Flying Sams. I started going because Dr. Talamantes invited me, and I started going once a month to Tijuana, and we see patients there who have literally nothing and live in like makeshift houses, and it's really just a lot of women and children, and it has been really rewarding and something that I never knew I really wanted to do, more like global health. And we go once a month, and we go there and we come back the same day, and it has been like just one of the things that, when you're a doctor, go outside of the clinic, like Dr. Partovi's doing. She's going on the streets looking for patients. We're driving to Tijuana. I go to a high school, take your clinic and take yourself out of the building and go to the community. And it's also been a great experience to mentor a lot of these students, and I know a lot of them are going to be really wonderful doctors. I also do, I volunteer at Homeboy Industries, mostly because I really want to work with a laser, but just kidding. I get to do laser tattoo removal, and it's also been super rewarding. When I heard Father Greg Boyle speak, and when I see his compassion and empathy for people who want to change their lives that were incarcerated or former gang members, it really spoke to me. And if I can help someone get a job by removing the tattoo on their face or hands that they got, when they were kids and they didn't know any better, or because they didn't really have any other choice, it has been really fun. And I've also used it as a way to bring students with me, and these are some of the students that have come with me to do tattoo removal. And some of them are doctors now, and some of them are in med school now. So it's been something that I've been doing the last 5 years, and it's been really interesting. If you ever had a chance, go to Homeboy Industries, or go to the cafe and eat, or buy the chips and salsa at Ralph's. Anything helps. And I just want to put a plug for family medicine. You're going to hear about a lot of specialties, but I'm going to always put is we really need primary care doctors that do everything. And these are some of my mentors, Dr. Granados, Puvula, and Andres. It has been so much, I've learned so much from them, and they do so much great in the world. It has been a real privilege to get to hang out with people that are so cool, and I really look up to. I've also gotten to mentor a lot of medical students from Drew and UCLA, so I'm a clinical instructor and faculty at Drew, so I get Richard, who's standing up. He's now a third-year peds resident. Minerva's applying right now, and Karen is the third-year family medicine resident. So it's been really nice to mentor the students, watch them grow, and see them become doctors. And Ricky asked me if he was going to be part of this speech. One of my greatest jobs is being Ricky's mother. And I told him I wouldn't put any pictures of him in this, but there's Ricky. And I take Ricky with me where I go. I was at a CCM banquet. I take him to Tijuana. And I want him to see what I do. And whatever he does, I'll be happy. But I want him to see what I do. And, I want everything I do it. And I hope that he'll be proud of me. And this is Ricky taking care of my dad, because he was asking me, how can I tell if Grandpa's breathing? And so I showed him to tell, So I think that's it. Do you guys have any? Do you guys have any questions for me? Anyways, I congratulate you guys on your conference and spending your 3-day weekend here. I already know if instead of you going to Mammoth or Palm Springs or something, you're here. I already know most of you are going to be in medical school soon. Thank you.